The nurse went to put in a feeding tube and put it in through his nose, and she started to struggle. And they told us, from what we could tell, it looks like the feeding tube that your son had went through his trachea and went into his lungs. Through our study, we've discovered there are probably at least 25% of children that are at risk of a misplaced feeding tube, and something needs to be done about it.
The standard of care in adults is to take an X-ray after every placement. The average patient in the ICU gets 2.5 feeding tubes, and the average feeding tube gets 1.5 X-rays to verify placement. So that's 4 X-rays per patient for feeding tube verification. In neonates, X-rays are avoided due to the risk of radiation. And so methods such as auscultation and aspiration are used. That involves using a syringe to blow bubbles in the tube and a stethoscope to hear the bubbles, or using the syringe to pull fluid and check if it's gastric fluid. Placement is essentially blind. If you consider the cost of complications, deaths, feeding tube verification, nursing time, and malpractice, it costs $1,900 per patient for feeding tube placement. Gravitas technology will reduce that cost by 86%.
Feeding tube misplacement is a big problem, but even when the tube is properly placed, patients are routinely underfed. It's known that early and aggressive enteral feeding reduces length of stay and improves mortality, but I generally don't do it in my patients due to the risk of overfeeding.
Current practice to determine feed status is again to use the syringe. They pull out the contents of the stomach to determine volumes, and then put it back to maintain pH balance of the patient. The sensorized Gravitas feeding system will continuously track reflux and gastric emptying and enable early, aggressive, and personalized feeding. Gravitas Medical has developed a smart enteral feeding system that guides placement safely into the stomach and continuously monitors for dislodgement. Once the tube is placed, the system provides the clinician with reflux and gastric emptying data to optimize feeding. With Gravitas technology, we are building smart feeding tubes, smart enteral feeding pumps, and we have the only data around formula and how it empties the stomach. Together, the enteral nutrition market is over $12 billion today. Gravitas employees have hundreds of years of experience building products, manufacturing products, and selling and commercializing. Gravitas Medical was formed to reduce NG tube complications, optimize feed, and help patients thrive, while reducing the overall cost of care.